Welcome back, everyone, to our classroom that we call the College of Glycation. I am Paul Reynolds, a biomedical scientist and professor of cell biology. And today we're going to dive into a topic that is critical for anyone touched by diabetes or anyone who wants to avoid it. We're talking about glycation and diabetes, which is a vicious cycle. If you caught our earlier episodes on glycation, you'll know already that glycation is a sneaky chemical process, one that causes problems throughout the body. And this chemical process is happening in our body right now. Today, we're building on that foundation and looking more closely at how glycation and advanced glycation end products, or AGEs, fuel the destructive dance with insulin resistance and diabetic complications like neuropathy and retinopathy. We will plan to unpack this idea of insulin resistance, trace the history of glycation in diabetes specifically, and lean on hard science to make sense of the whole story. So make sure your continuous glucose monitor is working, and let's get started. Let's kick things off with a quick refresher on the idea of glycation, because it is the foundation of this story that talks about diabetes. Glycation is a spontaneous reaction. It is a reaction in which no enzymes are necessary, nor is energy required. But this non-enzymatic reaction occurs when sugar molecules like glucose, fructose, and any other reducing sugar sticks to proteins, lipids, or nucleic acid. Remember, there's no enzyme that's needed. There's no regulation. Your sugar just misbehaves, runs around like a child loose on a playground, gluing itself to your body's machinery. Well, the result is problematic. The accumulation of advanced glycation end products, or AGEs, will be the outcome. These are stable yet damaging compounds that pile up over time and may not ever be eradicated completely. This isn't some newfangled theory. It's been around for a long time. We've talked about Louis Camille Maillard many times in the episodes that you've heard, and his work is traced back to 1912. And he noted very clearly how sugars and proteins form brown-like compounds when they're heated. Imagine a piece of bread that you heat, it becomes toasted or browned. That is what he was interested in, and he uncovered this idea of glucose with heat sticking onto proteins and causing a change. By 1981, we talked last week about Monnier and Cerami. They did a lot of work in the area of glycation and aging, but that seminal paper was profound because it also linked ages with diabetes, showing that age accumulation or glycation drives tissue damage that is made much worse in a diabetic situation. Today, we now know more than ever that ages are central to diabetic complications. And that's what we will explore today, how these glycation products amplify the chaos of diabetes. So what's the big picture? Well, diabetes, whether you're talking about type 1 or type 2 diabetes, is defined by high blood sugar, and that's where glycation thrives. When glucose levels are chronically elevated, more sugar molecules are available to run around, misbehave, and bind to proteins and lipids. In the process, they churn out AGEs at an accelerated rate. These AGEs are like molecular vandals running around the countryside. They damage tissues and trigger inflammation. There was an article published in 2019, just a few years ago, in the journal called Diabetes and Metabolism. The author was led by Fishman, and he and his colleagues showed that AGEs accumulate in diabetic tissues, correlating with complications like neuropathy, that's the brain disorders found in diabetics, and retinopathy. Those are issues with the eyes. But they went further and also detected age accrual as one of the main drivers of nephropathy, which are kidney issues, chronic kidney disease primarily. The higher the blood sugar, the more ages and the worse the damage becomes. It's this brutal feedback loop that we've talked about over the course of several episodes in our classroom. Ages cause trouble in two main ways. First, they form crosslinks with proteins like collagen and elastin. While we talked about this in the context of skin last time, the same collagen and elastin in skin is found in many other organs. And as they are cross-linked with glycation, they become stiff and impair the tissues as well as their function. Think of collagen as kind of like the scaffolding of your blood vessels, nerves, or organs. Glycation locks it into a rigid, dysfunctional structure. The second thing that ages do is they bind onto a receptor called RAGE, or the receptor for ages. And in the process, they spark inflammation and oxidative stress. Now, this was very clearly demonstrated in many publications, but one that comes to mind is a paper that was published in 2021. The study was published in the International Journal of Molecular Sciences. And the researchers in that case found that RAGE activation in diabetics amplify vascular damage, nerve dysfunction, and retinal injury. And this isn't just abstract science, mind you. It's why diabetic patients face so many diverse complications that slowly but surely erode their quality of life. So, what's the fuel for the fire? Well, we need to talk about insulin resistance because that is the engine that drives this glycation mess in type 2 diabetes primarily. Insulin resistance is when your cells, especially the muscle and the liver and fat cells, stop responding to insulin, which is a hormone that tells them to pull glucose from the blood. If you have a spike in blood glucose, what the cell does is it allows it into the cell and it rushes to the mitochondria, compromising their function. The second thing is that when you have a spike in blood glucose, a lot of this extra sugar is available for glycation. But your body is trying to remove these two harmful equations, this um, resistant or issues in mitochondrial biology, thus leading to oxidative stress and inflammation, but also glycation. So this elegant system, this hormone known as insulin, is going to be released so your body can respond to high glucose by hiding it in cell types like muscle, fat, and the liver. So when they pull glucose from the blood, the result is that blood sugars stay relatively low. But when they cannot pull these glucose molecules from the blood sugar stays high, and your pancreas pumps out more and more insulin to compensate until it simply just can't keep up. Now, I've spent years studying these conditions, and this is, in fact, a metabolic issue, a disaster, really. High blood sugar means more glucose is available for glycation, churning out ages that damage tissues along the way, therefore further worsening your insulin resistance. This cycle is vicious. So, why is this insulin resistance situation such a problem? Well, beyond elevating blood sugar, it also creates a cascade of metabolic chaos. In 2017, there was a review published in the Journal of Traditional and Complementary Medicine, and they noted that ages impair insulin signaling by modifying insulin receptors and downstream proteins, making cells even less responsive. But here's something that's crazy. Did you know that glucose can also glycate insulin itself? So while the cells are less responsive, the insulin itself is also damaged or its effects compromised because of glycation. So all of these processes work together. Ages also trigger oxidative stress. I've alluded to that already in the form of mitochondrial misbehavior. But when the ages trigger oxidative stress that damages mitochondria, those organelles that are in charge of utilizing sugar for energy, further uptake of glucose is impaired. Now, that was apparent in 2024, just last year. A publication in Endocrine Disorders found that skin ages measured by autofluorescence directly correlated with HbA1c, which is a marker of long-term blood sugar. You've undoubtedly heard of A1C. It is a clinically relevant signature that a physician might look at to help diagnose your diabetic state. The percentage of your hemoglobin in red blood cells that are glycated is presented in the clinic from a range of about 5% beyond. Once you hit past 5.7%, you are considered pre-diabetic. And what that means is that 5.7% of your hemoglobin is glycated, or it's been around higher levels of sugar than would otherwise be acceptable. Once you hit 6.5% on that scale, A1C levels beyond 6.5% are directly associated with the diagnosis of diabetes. So if you have a correlation between this diabetic marker, HbA1c, and skin autofluorescence or age accrual, insulin resistance in diabetic patients are definitely linked. In other words, the more glycation, the worse your metabolic control will be. Now, for diabetic complications, this can be catastrophic. High blood sugar and ages directly damage nerves, blood vessels, and retinas. In 2015, there was a study in diabetes care, and the researchers showed that ages like methylglyoxal are elevated in poorly controlled diabetic patients. And what they did was use that marker as a good predictive measure for neuropathy and retinopathy, or neurological damage and eye damage. Uncontrolled blood sugar fuels glycation, which fuels tissue damage, which again fuels worse glycemic control. It's like a car, if you think of it this way, with a stuck accelerator careening toward complications with a lack of an ability to slow down. So let's zoom in on one of the main complications that diabetics experience, and that is neuropathy, one of the most debilitating complications for diabetics. Neuropathy is essentially nerve damage that causes tingling, numbness, or pain, often in the hands and feet of diabetics. Up to 50% of diabetic patients develop neuropathy, and glycation is, in fact, a central culprit. Ages accumulate in peripheral nerves, cross-linking proteins and disrupting their function, or neurotransmission particularly. In 2020, there was a study in the Journal of Clinical Medicine, and the researchers found that ages impair nerve conduction by damaging myelin. That's the nerve's special insulation that allows them to traffic their signals quickly. And axons, those are the nerve's wiring, were also damaged. Ages bind rage in the nervous system, and in the process, damage the tissues by triggering inflammation. And that will further, I promise, further stress out these nerves. Now, high blood sugar will exacerbate all of this condition that you see in neuropathies. Glucose overloads nerve cells, generating free radicals or reactive oxygen species. That's the oxidative stress that amplifies age formation. Now, we saw this in 2019, among other instances, in a journal article published in the journal Diabetes and Metabolism. The researchers showed in that case that ages correlate with nerve fiber loss. And that basically explains why diabetic patients lose sensation over time. Neuropathy isn't just uncomfortable, it increases the risk of falls, infections, and eventually amputations. Controlling blood sugar is challenging, but it is critical because every spike will fuel even more glycation and nerve damage. The other main consideration that diabetics have relates to vision that is risky or at-risk vision. That's retinopathy. So let's talk about this form of retinopathy called diabetic retinopathy, a leading cause of blindness. Retinopathy occurs when high blood sugar damages the tiny blood vessels in the retina. The retina, as you know, is the light sensing layer of your eye. Ages play a starring role in this event. In 2023, there was a study published in Frontiers of Endocrinology, and the researchers demonstrated that ages accumulate in small retinal capillaries. And what that did was it led to vessel leakage and pronounced inflammation. This leads to some swelling. That's called macular edema or abnormal vessel growth, which is proliferative retinopathy, both of which impair vision. You might get dark spots initially, but eventually vision is impaired in both of these cases, swelling in the eye and abnormal vessel growth. Now, ages wreak havoc in two ways in this condition. First, because they cross-link with vascular proteins, they stiffen the blood vessels in your retina and reduce blood flow. Second, rage also activates or triggers inflammation, and this comes in the form of small molecules called inflammatory cytokines. These damage the very sensitive retinal cells. In 2021, there was an article published in the International Journal of Molecular Sciences, and the researchers demonstrated in this case that age-modified proteins in the retina disrupt the blood-retinal barrier. And what that did is it allowed fluid to seep in, causing excess pressure and greater inflammation. Poor glycemic control will accelerate this. Every HbA1c point above 6% increases retinopathy risk. So here is a stark reminder. Blood sugar control isn't just about numbers, it's also about saving your sight. Control it better and improve your vision. Now, beyond neuropathies and retinopathy, there are also body-wide problems or systemic effects, because glycation's damage isn't limited to just the nerves and the eyes. Although A1C levels will identify glycation happening in your red blood cells, it's basically a proxy marker for glycation happening throughout the body, a systemic story. Ages stiffen blood vessels. They contribute to hypertension, atherosclerosis, and other issues. In 2017, in the same article that I referenced earlier, found in the Journal of Traditional and Complementary Medicine, they found that glycated collagen in arteries reduces their elasticity, raising your cardiovascular risk. So what happens when the physician says, hey, your blood hemoglobin levels or A1C levels are at about 5.7%. You're in the pre-diabetic range. Well, what often happens is that the physician might simply say, this is getting elevated. Let's just track it for a while. Let's keep an eye on it. But what the physician likely won't tell you is that at 5.7 on your A1C levels, you're over 300% more likely to have cardiovascular failure or heart attack than if you were at 5%. So again, controlling blood glucose levels has great benefit. In the kidneys, let's talk about those for a moment in a diabetic sense. Ages promote fibrosis. And what that does is it leads to diabetic nephropathy or hindrances in the normal function of your kidneys. In 2024, in the journal BMC Endocrine Disorders, there was a study that linked ages to liver fibrosis and diabetes, as well as kidney fibrosis. And that shows how glycation reflects a much deeper level of organ damage. And that, again, is why diabetics and diabetes specifically is a systemic disease, not just a failure to control blood sugar. Rather, what happens when failed blood sugar control leads to glycation? Why? Well, glycation hits every tissue, and insulin resistance keeps that cycle spinning. So if you take a step back and appreciate the idea that glycation and diabetes are linked, you can take a bit of a historical perspective. I've already mentioned Maillard's work in 1912. I mentioned Monier's work and Cerami's work in the 1980s. In 1983, there was work done that linked A1C levels as a marker clinically relevant. Researchers in the 1990s found that age and rage interactions cause inflammation, and inflammation is one of the main foundational aspects of diabetic progression. So recent trends are promising in our ability to look at non-invasive ways to evaluate glycation. I've mentioned in a few episodes now the role that skin autofluorescence may have as a non-invasive way to evaluate ages reliably. I mentioned previously in the Journal of Diabetes Research in 2022, Vanderheyden and colleagues found that skin age formation predicts diabetic complications and it correlates to glycemic control. All of this story is coming full circle. Think of glycation detected anywhere in the body as a form of radar, suggesting that diabetic complications may be right around the corner. Now, there is some research that I mentioned previously about anti-glycation strategies. I believe that the most prominent way to address glycation is controlling carbohydrate consumption. But in 2023, in the journal Frontiers of Endocrinology, there was some studies that were published that focused on aminoguanidine and polyphenols. These are molecules that are thought to block age formation or neutralize their receptor, RAGE. So there is some promising data out there. Mostly these polyphenols, I believe, may have more weight that might mitigate age-rage interactions and therefore starve off this idea of inflammation. Now, dietary ages are another hot topic, but for the record, only about 10% of the ages that you ingest, that's considered exogenous glycation, only 10% you will retain in the body that can then cause problems. The liver does a great job of eradicating most of the dietary ages, but it doesn't mean that we should eat all the processed food we want. High age foods like fried foods, excessively grilled meats, highly processed foods, all of these will increase circulating ages. And if you're retaining 10%, starting at a much higher level still will provide a massive burden. So the bigger picture is sobering. As type 2 diabetes surges, in fact, there are over 400 million cases globally today, glycation's impact in this area of health and wellness is growing. Insulin resistance, driven by obesity and processed diets, is at the root of this predicament. In 2024, let me just end by describing once again this endocrine disorders publication that showed that higher levels of ages in younger diabetic patients signaled earlier complications. So the timing of adjusting your lifestyle is key. Start today by improving your lifestyle. In modern lifestyles in which high sugar foods, sedentary habits, all of those types of situations occurring, there is major fuel that's being poured on this glycation fire. So let's wrap up by breaking the cycle as best as we can. What is the main takeaway? Well, glycation and diabetes are a vicious cycle that feed on one another, with ages and insulin resistance driving the key complications experienced by diabetics, including neuropathy, retinopathy, and nephropathy, or nerve damage, eye damage, and kidney problems. High blood sugar levels fuels glycation, so cut back on the high blood sugar because glycation will damage tissues and worsen your sensitivity to insulin. The science is clear. Control your blood sugar is important. Controlling it is non-negotiable. Cutting refined carbs and sugars, prioritizing whole foods, and staying active will slow age formation. Low age cooking like steaming, poaching, more so than over frying and excessive grilling will also be helpful. Emerging therapies like RAGE inhibitors are on the horizon, but lifestyle, I promise, is your best weapon today. Your health is a reflection of your choices. So let's make good choices together. Neuropathy, retinopathy, nephropathy, vascular damage are not inevitable. You can fight back and take control and break the cycle. Thank you, everybody, for joining me today. I will see you next time. Remember, stay sharp and stay healthy.